Let's go.
Clinical skills examination. Introduction, general assessment, behavior, and mental status. Indicate intent to wash hands and don PPE as appropriate prior to exam. Introduce self as PA student. Ask patient how they're feeling today and are they currently in any pain.
How you feeling today?
Good.
So why are you here?
Physical.
Physical? Okay. And any pain or anything? Not all right now. Okay, so with all of the scale, a 0 is like you're not in any pain at all, but 10 is like the worst pain you've ever had.
I'd be a 0.
0? Okay, good.
Verbalize measure of pain using pain scale if needed. Pain is 0 out of 10. Assess levels of consciousness and orientation.
So you told me that you're here for the physical exam, right?
Mm-hmm.
Where are you at?
I'm at the clinic.
At the clinic. And what day is today?
Today is Friday.
And who is the president of our United States?
President Joe Biden.
All right, good.
Verbalize patient is alert and oriented ×3. Evaluate speech, dress, and behavior. Verbalize appropriate speech, dress, and behavior. Assess vital signs. Assess pulse rate, respiratory rate, and blood pressure using proper technique.
So first, we're going to be doing this for 30 seconds, okay? Here we go. Okay, pulse is 62 and respirations are 14. Now we're going to check the blood pressure. Okay. Should use this, huh? All right, 118/72. That's a good one.
Record and report vital signs to preceptor and determine if patient is stable or unstable. Verbalize vital signs are pulse 62, respirations 14, blood pressure 118/72. Patient is stable. Now begins the head, face, and scalp examination. Inspect and palpate head and face, including hair and scalp.
Okay.
Verbalize normal cephalic. Hair texture is normal without infestations. Scalp has no scaling or lesions. Next, test cranial nerve 5. Test sensory trigeminal nerve using light touch.
All right.
Include
So,
assessment of all 3 branches
I'm gonna have
bilaterally.
you close your eyes, okay? And then as I touch your face, you're going to tell me where it's at, okay?
Okay.
All right, close your eyes for me.
Left.
Left what?
Left forehead.
Okay.
Right cheek. Left chin. Right forehead. Left cheek. Right chin.
Okay.
Verbalize no sensory deficit. Next, continue testing of cranial nerve 5. Palpate muscles of mastication during jaw clench.
Okay. So place your cheek. Okay.
Inspect and palpate mastoid bilaterally. Palpate both temporal and masseter muscles separately.
Okay. Good to go.
Verbalize mastoid is non-tender and without discoloration. Symmetric motor function. Inspect and palpate temporal artery bilaterally. Verbalize, temporal artery is non-tender. Inspect and palpate parotid glands. Verbalize, parotid glands are without nodules or irregularity. Inspect and palpate TMJ with motion.
Okay, so I'm gonna hold you right here. Open up your mouth and go side to side for me. Okay, good. Close it. Okay, good.
Verbalize, TMJ not tender and without swelling. Next, inspect cranial nerve 7. Inspect for symmetry of facial movement. Include muscles in upper and lower face.
Okay, so just do the same thing I do, okay?
Okay.
Smile, okay, and show me your teeth. Okay, good. Now, frown for me, okay? And close your eyes. Don't let me open them, okay? Okay. Now, puff out your cheeks, and don't let me push it. Okay, good job.
Verbalize, symmetric motor function. Now begins eye examination. Begin by testing cranial nerve 2. Check visual acuity with corrective lenses if applicable.
All right, so I'm going to have this for 14 inches, and I'm going to want you to close your left eye for me. Okay, there you go. And read the lowest line.
3, 7, 4, 2, 5, 8.
All right, now switch the eyes for me and read the lowest one again.
3, 7, 4, 2, 5, 8.
Okay, now let's do this with both of your eyes.
9, 3, 7, 8, 2, 6.
All right, so that's 2025 OU, and then 2030 OS and OD.
Next, inspect eyebrows, lashes, and lids.
So I'm just inspecting it right now, so I'm not going to use the light, okay? So I'm just looking around, okay? Okay?
Verbalize, no exophthalmos, lid lag, ptosis, periorbital discoloration, edema, or skin lesions. Next, inspect and palpate lacrimal duct.
This right here. Now I'm going to drop you down so I can see the lacrimals and then push it. Okay?
Verbalize, no swelling and no regurgitation. Next, inspect conjunctiva and sclera.
Okay, so for this, I am going to use my light this time, and I'm going to have you help me with the raising of your eyes and then also lowering your eyes, okay? So let me look first. I'm looking around, right? Raise your eyebrows up for me with your hands. Just like that, okay, good. Look down, look left, and look right. Okay, now switch and pull your eyelashes down, okay? Look up, look down. That one doesn't work, right? Look left and look right. Okay, good.
Verbalize, no injection, icterus, lesions, edema, or foreign bodies. Next, test cranial nerves 3, 4, and 6. Evaluate for conjugate movements and nystagmus.
Okay, so I'm going to use my the pen light and just follow it, okay? Here we go.
Evaluate 6 cardinal positions using H pattern. Movement should be controlled and slow enough to elicit nystagmus if present.
Okay.
Verbalize, EOMs full and equal. Next, assess for near pupillary reaction or accommodation.
Okay, so I'm going to hold this up here, and I want you to look at this. When I tell you so, I want you to look behind me at the clock that's on the wall, okay? So look here, Look at the clock. Look here. Look at the clock. Okay.
Verbalize. Pupils constrict with near focus. Inspect anterior chamber.
Okay. So I'm gonna
Shine a pen light at the cornea and inspect cornea, anterior chamber, and lens.
Okay.
Verbalize. No abnormalities of the cornea, anterior chamber, and lens. Next, inspect iris and pupillary reaction to light.
Okay. So I'm gonna come in here, right here. I'm gonna be going in like this. I'm gonna go there. I'm gonna flip around here and there. Okay. Good.
Verbalize. Pupils are equal, round, and reactive to light bilaterally. Next, evaluate the position and alignment of eyes using the Hirschberg test.
Okay. So I just want you to stare and just look right at my nose. Okay. Okay.
Verbalize. No tropia. Assess for pupillary convergence.
Okay. So I'm gonna have you right here and just stare at it all the way. Okay. So I'm gonna come in right here. Okay. Good.
Verbalize. Eyes converge equally. Now begins the ophthalmoscope examination. Ophthalmoscope exam technique. Use same eye as patient for examination. Brace free hand against patient's head or shoulder and move in close enough to visualize fundus.
Look at the light. Okay, good.
Perform examination bilaterally.
Look at the light. Okay, good.
Verbalize. Bilaterally, red reflex is present. Cornea, anterior chamber, lens, and vitreous are clear. Disc color is pink. Margins are sharp and cup to disc ratio is 1 to 2. AV ratio is 2 to 3. There are no hemorrhages or exudates, no lesions on macula. Now begins the ear examination. Inspect and palpate auricles and tragus bilaterally.
Does that hurt you at all?
Verbalize. No lesions or tenderness. Assess cranial nerve 8. Assess auditory acuity.
Okay, so I'm gonna have you close your eyes, and I'll be just rubbing my fingers together, and I just want you to let me know if it's your left ear, if it's your right ear. Okay.
Okay.
Close your eyes for me.
Left. Right.
Verbalize. No sensory deficit. Now begins the otoscopic examination. Otoscope exam technique. Brace hand against patient's head or face. Position otoscope at the opening of canal, then peer through lens to visualize entire canal.
Hold your nose and Valsalva for me. Okay, good. Switch to the other side.
Perform otoscopic examination bilaterally.
Valsalva for me. Okay, good.
Verbalize. Bilaterally. No swelling, redness, or obstruction. Pearly gray and translucent. Light reflex is anterior inferior quadrant. Landmarks undistorted. No fluid behind TMs, and TMs are mobile. Now begins nose and sinus examination. Begin by inspecting the nose.
Look up for me a little bit. Okay.
Verbalize. Nose is midline and without lesions. Next, check patency of nares.
Okay, so I'm gonna have you close one of your nostrils for me, and breathe in and out. There you go. Okay, now switch to the other one. Same thing. Okay, good.
Verbalize, nasal passageways are patent. Assess cranial nerve 1. Test each nostril separately while occluding the opposite.
All right, so I'm gonna have you close your right nostril and also close your eyes. And what do you smell right here?
Mint.
Okay, good. Now let's switch it to the other side. And tell me what you smell right here.
Lemon.
Yes, good job.
Verbalize, no sensory deficit. Next, palpate or percuss paranasal sinuses.
Tap me here, tap me here.
Verbalize, no maxillary or frontal tenderness. Now begins the nasoscopic examination. Inspect septum, turbinates, and floor of nasal cavity. Inspect mucosa for color and lesions. Inspect for discharge. Technique, ask patient to tilt head back, just lightly as needed, and examine with the speculum all areas of the nasal cavity. Perform bilaterally. Verbalize, mucosa is pink and moist without lesions. Now begins the mouth and throat examination. Begin by inspecting the lips and oropharyngeal mucosa.
Hold up this. Okay, hold on. I'm just gonna okay, so just okay.
Verbalize, lips are pink and moist without lesions. Now, inspect tonsils and uvula with light source. Test cranial nerve 9 and 10. Inspect for midline rise of uvula and soft palate on phonation.
Open up your mouth. Say ah. Okay, good.
Verbalize, tonsils are grade 2 and equal with midline uvula. No exudate or lesions. Uvula is midline and soft palate rises symmetrically. Next, assess breath odor. Verbalize, no abnormal breath odor. Inspect tongue surface with light source.
Open up your mouth. Stick out your tongue for me. Okay. Lift it up. All right, good.
Verbalize, no discoloration or lesions. Next, inspect gingiva and teeth with light source and then percuss teeth with tongue blade.
Okay. Again. So I'm going to be looking at gingiva. Bring the light. Up. Oh, sorry. You get it there. And open up again for me. Any of this hurt you?
Mm-mm.
Okay. Okay, good.
Verbalize, no lesions, swelling, or discoloration. Teeth are in good repair and non-tender. Next, assess cranial nerve 9 and 10. Assess gag reflex using tongue blade.
Okay, open up. Say ah. Okay.
Verbalize, gag reflex present. Next, assess cranial nerve 12. Inspect tongue for midline position without deviation.
Okay. Stick your tongue out for me. Okay, good.
Verbalize, tongue is midline. Now begins neck examination. Inspect skin of neck and trachea. Palpate trachea for position and mobility. Verbalize, no lesions, swelling, or discoloration. Trachea is midline and mobile. Next, palpate lymph nodes of neck and head. Verbalize each lymph node chain as you palpate.
Occipital. postauricular, preauricular, tonsillar, submandibular, submental, anterior cervical, deep cervical, posterior cervical, and supraclavicular.
Verbalize, no lymphadenopathy. Test active range of motion of neck, flexion, extension, rotation, and lateral bend, and neck strength, cranial nerve 11.
Exactly like I do. Okay, so look up, look down, come back up, look there, and look to your other side, and come here, here, to the shoulder, and then same thing on the other side. Okay, good.
Verbalize, neck is full range without symptoms, and cranial nerve 11 is intact. Next, test neck strength cranial nerve 11 via shoulder shrug and neck rotation with resistance.
Okay, resist me, push up, okay, look to and look to your right. Okay, good.
Verbalize, cranial nerve 11 is intact. Strength is equal bilaterally. Now begins lung and chest posterior thorax examination.
So I'm gonna have you
Inspect chest and palpate for tenderness and for symmetrical chest expansion.
Well, he's saying chest, so let's go ahead and whip around and we'll look at it around. Okay. Okay, so anterior.
Yep. Verbalize, anterior chest is symmetric without lesion or cyanosis, no masses, crepitus, or tenderness. AP, less than lateral diameter, chest expands equally. Percuss lung fields, 2 paired areas.
So I'm gonna percuss you.
Verbalize, no areas of dullness. Auscultate symmetric lung fields. Verbalize, equal bilateral with no adventitious breath sounds. Now begins the posterior thorax examination. Inspect and palpate for tenderness and for symmetrical chest expansion.
Take a deep breath in for me. Okay, good.
Verbalize, posterior chest is symmetric without lesion or cyanosis. No masses, crepitus, or tenderness. AP greater than lateral diameter. Less than lateral diameter. Chest expands equally. Now percuss lung fields, 2 paired areas. Verbalize, no areas of dullness. Now, auscultate lung fields.
Deep breath in and out whenever you feel the scope, okay?
Verbalize, equal bilateral with no adventitious breath sounds. Now begins cardiovascular examination. Auscultate with bell and diaphragm at 4 valvular locations and Erb's point. Verbalize areas as you proceed.
All right, so I'm going to listen to both the bell and of the diaphragm and all of the areas, okay? So we're going to start off with aortic bell, diaphragm, pulmonic bell, diaphragm, Erb's point at the bell, at the diaphragm, tricuspid with the bell, and with the diaphragm, mitral with the bell and the diaphragm.
Verbalize. Rate and rhythm are regular without murmurs, gallops, or rubs. Palpate bilateral peripheral pulses. Radial, dorsalis pedis, and posterior tibial pulses.
So radial pulses. Dorsalis pedis. And the last one right here. Okay.
Verbalize. Pulses are full and equal bilateral. Inspect nail beds and estimate cap refill.
I'm going to do your thumbs.
Verbalize. No peripheral cyanosis. Capillary refill is less than 2 seconds. Now begins abdominal examination. Begin by positioning your patient. Move patient to flat supine position and expose or drape. Knees must be flexed prior to palpation. Inspect the abdomen.
It's going to start down first, and then once I start to do all of the light stuff, then I'm going to raise it up, okay?
So
I'm inspecting right now.
Verbalize. No discoloration, lesions, or scars. Contour is flat. Auscultate for bowel sounds. Verbalize. Normoactive bowel sounds. Percuss abdomen. Verbalize. No abnormal pattern. Light palpation of all 4 quadrants with knees flexed. Verbalize. No areas of tenderness, guarding, rigidity, or superficial masses with light palpation. Now perform deep palpation of all 4 quadrants with knees flexed. Verbalize. No abnormal masses. No organomegaly. No areas of tenderness or guarding with deep palpation. Now begins lower extremities examination.
All right, so I'm going to have you drill down here.
Inspect and palpate the bones, joints, and soft tissues of the lower extremities.
Tell me if this hurts you at all, okay?
good.
Okay.
Verbalize. Hips, knees, ankles, and toes are symmetrically aligned without atrophy, deformities, fasciculations, or tremors. No soft tissue swelling, tenderness, or discoloration. Now assess active range of motion of hips, knees, ankles, feet, and toes.
Right, so as we're going to do all the range of motion, I'm going to have you to touch my hand, okay? So I'm going to put it here and touch your knee to my hand, okay? Now the foot all the way up here, okay? And then all the way down. Okay, I'm going to do the same thing on this side over here. So knee right here, and then hand up here, and then all the way down. Okay, good. Now I'm going to have you rotate over onto this one. Okay. I'm going to do first 3 steps, all of the upper leg, and then the last one, it'll be the lower leg, okay?
Okay.
So kick my hand over here. Okay. Now all the way back here. Okay, good. Now all the way up here, and then all the way down. Now kick me with this other one here. Okay, good. Roll over. We're going to do the exact same thing, okay? So, kick me over here, okay? And then bring it back all the way here, okay? All the way up, all the way down, and then the other one. Good job, okay? Now, let's sit up. So we've already done the hips and of the knees. So let's do the ankles, right? So bring them up, push them all the way down, come in, and go out. Now, with the toes, squeeze them in and extend them out. Okay, good.
Verbalize full active range of motion on examination. Next, evaluate strength of lower extremities. Assess and grade strength of the major muscle groups of the lower extremities.
Remember to fight against me, okay? Push up, okay? Push up, okay? And down. Okay. And sit right here. Push out. Push in. Okay, good. Push up and push down. Okay, and then push up and then push down. Okay, good.
Verbalize bilaterally 5 out of 5 strength. Now begins the upper extremities examination. Inspect and palpate the bones, joints, and soft tissues of the upper extremities.
Again, like I said before, just tell me if it hurts. Okay.
Verbalize shoulders, elbows, wrists, and fingers are symmetrically aligned without atrophy, deformities, fasciculations, or tremors. No soft tissue swelling, tenderness, discoloration. Next, assess active range of motion of the shoulder, elbow, wrist, hand, fingers, and thumb.
All right, so I'm going to have you step up for the first time. So step down and then stand and up in front of me. And you're going to do the exact same things that, okay? So first we're going to come up here and touch our hands. Then we're going to come down and we're going to cross over. Okay, good. And then we're going to come down. So that was that one. Next, it's the flex and extend, right? So we're going to come straight up, and then we're going to go straight all the way back. And I'm looking to see that they're equal. Okay, good. Next, we're going to be doing some internal and external, and it's going to be like an S, okay? So coming up and over, okay? And then switch it to the other side. Okay, good. All right, so that is all for of the shoulders. Now with the elbows, flex them up, flex them out, come up right here, and flip them over, and supinate right there. Okay, good. Next up is the wrist, right? So we're going to pick them up, and we're going to bring them down, and then we're going to go in, and then we're going to go out. Okay. Range of motion now for the fingers, right? So open them up, close them in. Okay, flip over like this. Okay, flex, extend. Okay, adduct, abduct, and then we're going to touch each individual finger. Okay.
Verbalize full active range of motion. Evaluate strength of upper extremities.
Let me have a seat down here. So I don't have to make it stand up. Okay. Again, it's going to be resist. Okay. So I'm going to go out and then go in. Okay. Push out. Pull in. Okay. Good. Now here with the elbow, I'm going to do both the biceps and then also of the triceps. So out, push out, okay, and pull me in. Okay, good. Push over here, push it out, and pull it in. Okay, good. Now we're going to do your wrist. Okay, so push up and then push down. Okay, good. Now with the fingers, just open them up like this. Don't let me press them. Okay, here and here. Lastly, like this, and don't let me break it. Okay. Now grab a hold of those, and I'm going to pull them. Okay, good.
Verbalize grade of strength. Bilateral upper extremities, 5 out of 5. Now begin spine examination. Begin with inspection.
Stand over here. Okay. Come up like this. I'm just going to look back. Okay.
Verbalize. No deformity of the spine. Scapula, shoulder, and iliac height are symmetrically aligned, and there is no atrophy, swelling, or discoloration. Now, palpation of spine and soft tissue.
Which is what I just did. So we'll do it one more time. So starting at the top and coming all the way down. And this is done after inspection. Okay.
Verbalize. No step-off deformity or tenderness of spinous processes. No swelling, heat, or tenderness of soft tissues. Assess active range of motion of the spine.
Okay, so with this, I'm going to stand over here next to you, and I'm going to tell you what to do, okay? So for right now, bend over and touch your toes, okay? All the way back up and lean back, okay? Come back up, look over and twist towards me, okay? Now twist the other way, okay? Lastly, I want you to take your hand and touch your knee. Good. Now the other side. Okay, good.
Verbalize. Spine is full active range without pain. Now begins neurologic examination, deep tendon reflexes.
Alright, so what we're going to do is first I'm going to start with the brachia. So there's the tendon. I'm going to get right here. Relax for me. Relax. There you go. Okay. I'm going to test it on the other side. Okay. Now I'm going to do triceps. Bring it up over here. And again, relax. Okay. I'm going to do the same thing on this side. So relax. There we go. Bracho radialis. So I'm going to hold on to you right here. There we go. See that? Same thing again over here. Go right here. Okay. Next, I'm going to go down and do the patella. So, relax for me right here. Okay. So we're going to do the same thing over here. lastly, almost lastly, I'm going to do Achilles. And I'm going to twist you in just a little bit like this. Okay. There we go. And then lastly is the one that's not the funnest one, right? And I'm going to bring you up and over. Okay.
Verbalize. DTRs are 2+ and symmetric bilaterally. Toes are down going. And that concludes our clinical skills examination.